freedom to see whoever you want is not necessarily only an outpatient thing, but it's also inpatient. So if you land in a hospital and need bypass surgery because you just had a heart attack, theoretically, you may not have access to all the surgeons that are available even within that hospital.
Dr. Jonathan Baktari.
You can see it. I mean, it's crystal clear.
I think it's going to really revolutionize things.
Which is a big game changer.
Hi, welcome to another episode of Baktari MD. I'm Dr. Jonathan Baktari, and today I want to talk to you about health insurance. It's open enrollment time, and a lot of us are struggling about how to proceed and make the right decisions for ourselves, for our family, for our children. And, you know, there's a lot of confusion, a lot of complexities in picking the right insurance plan. And I want to really talk about this so you can approach this decision from a place of knowledge and information. Because what I'm about to share with you doesn't necessarily tell you what decision to make. It just helps inform you so when you do make a decision, you're basing it on all the facts. And let's start off with the biggest issue, which is HMO versus PPO. I think this is something a lot of people struggle with because, you know, the lure of an HMO is often, you know, better in terms of economics. And PPO is often better, obviously, for many other things such as choice, a variety of options, and what have you. So what I want to compartmentalize is broadly what an HMO versus a PPO is in the most broadest sense. I mean, within plans, there's different grades and different deductibles and all of that. But let's just put that out on the side for a second. What I want to talk about is when you choose an HMO, it's generally cheaper. Now, why is an HMO generally cheaper? The way HMOs are able to provide you with a product at less price is obviously because they cut some things out. What do they cut out, broadly speaking? Broadly speaking, what they cut out is often your choice to pick a doctor, and often your choice in determining what is medically necessary. And often that choice is also removed from you and your doctor about what is medically necessary. So you have to understand that the way the health insurance is able to cut costs on an HMO is by doing those things in broadly speaking. One, they limit the number of physicians you can see, which in itself you would think shouldn't be cheaper, but it is, because the doctors that you are going to be able to see are going to be managed differently. In an insurance plan, often doctors are either employees of the insurance plan, or even if they're contracted, the way they're compensated, incentivized, and monitored is by looking at their utilization. So those doctors may or may not have certain incentives to be cost effective in managing your care, which, by the way, sometimes can be good. We certainly don't want excesses and over testing and what have you. And also they serve as a gatekeeper to often try to handle things which maybe a normal primary care doctor in a PPO would not want to take the extra time with, to make sure you don't run off to a high-price specialist when in fact it could be managed by your primary doctor. So it's all the cost savings are not necessarily bad in the sense that they're, if you want to use the analogy, they're cutting some of the fat. I think what happens is, depending on the HMO or the particular situation, there's a fine line between, you know, cutting the fat and cutting into the bone, which is, you know, cutting back too much. So I think when you sign up for an HMO and you get a lower price, what you're in essence doing is giving a lot or some of the control back to the HMO and taking it away from you and potentially even your doctor. Because in a lot of standard non-HMOs, you and your doctor, for the most part, pick what's medically necessary, what's appropriate, often what medication. But when you go to an HMO, they will limit your care to what they determine is medically necessary. And then even on the pharmacy side, they have a limited formulary, which often includes cheaper drugs within every category often. And only after you have gone through the hierarchy from cheapest off and most expensive can you get access to some of those other drugs. So I think all things being equal, you have to understand for the most part, when you pick an HMO, you're consciously deciding to get less of a product, not in terms of medical care, but some of those other intangibles for a lower price. I mean, the way I'd like to serve it up, for the most part, if an HMO costs the same thing as a PPO, nobody would ever pick an HMO. So you have to understand when you pick an HMO, for the most part, you're picking it because you value the economic advantage of having an HMO, meaning you're going to pay less ideally. So I don't think anyone should fool themselves in saying, oh, I'm an HMO person, I like HMO, because there are severe downsides. And even, some of the good sides of an HMO where they make sure excessive care is not given and excessive procedures aren't done, you could probably get that same benefit in a PPO plan if you picked the right doctors and did your homework and, were a little bit diligent. So someone could make the argument that you can get all of the benefits that a PPO give you, meaning the benefits in terms of excessive procedures, excessive tests, excessive visits, and unnecessary high or expensive prescriptions when there was a cheaper one. So those are all potential things that could happen. Yes, and an HMO will definitely do a better job potentially at that. But you could theoretically, given the right skill sets and the right doctors, you could theoretically capture that without giving up some of the autonomy. And getting back to this idea of picking your doctors too, you have to understand with an HMO, often that HMO is confined to a certain geography, a certain location, and within a geography, maybe a certain set of doctors. So if you wind up wanting to go to a world-class medical center for a particular problem, you want to go to Stanford, Harvard, UCLA, it may be that your HMO is not going to allow you to go. Now, if you're healthy and nothing's going on, you're probably thinking, well, what the heck, I'm okay with never going to an Ivy League medical place. But God forbid, if you do get a rare complication and you need a bone marrow transplant, a liver transplant, or anything very complex, you may want the option of going to one of these major institution, MD Anderson for cancer. These are options that often you're taking off the table, not always, but often, when you decide to go with an HMO. And so what I'm here to tell you is I'm your advocate. I'm not saying you shouldn't sign up for an HMO. I'm simply saying if you do, you should know what you're taking off the table potentially. Not all HMOs are the same. Some are different. Some you can appeal. Some you can make a case for it. But it won't be as simple as if you were not in an HMO. And you need to understand that. Far too often I hear people who come down with something very rare and they're relatively young, but they're stuck with an HMO. And they say to me, oh, if only I knew how restrictive this was, I would have never signed up for it. But again, that's easier said than done when you're young or middle-aged and healthy and have no issues. And you're looking at two bills, one, hundreds of dollars more a month, potentially maybe more than the other one, and saying I'm healthy, nothing's going on with me. Well, why not choose the cheaper one? But again, that's okay. I mean, the cheaper one's always better if you never get sick and never need something complex and never need the ability to make your choice of where to go and what to have. So I think you need to understand that. And as long as you do, then an HMO might be the right thing for you. I know this insurance stuff is complex. It's like it has its own vocabulary, its own universe. So if I can help you, please leave a comment or a question below, and I will try to give you as much help and insight as I can. I'm here to kind of help you at least navigate some of this so you can make the right decision. So let's move on and just talk about PPOs. Now, PPOs come in all shapes and flavors and combinations, but again, I'm speaking only broadly, and there are hybrids and what have you. But I think the way PPOs approach it is, and I think you have to be careful for PPOs too, is you wind up having large potential deductibles that you have to get through before you get there, and what have you. But generally speaking, PPOs will offer you a wider selection of physicians, and depending on your PPO, you may be able to go out of your geographical area into other states and what have you. So you have a lot of benefits that you may not. And yes, while the insurance company may review some of the tests that are ordered for you, what have you, by and large, more of the medical decision making is between you and the doctor, as opposed to some bureaucrat sitting in an insurance company who doesn't know you. So I'm going to go out on the limb and say, if you had an option for a PPO and HMO, putting aside that some PPOs can have very large deductibles, but let's put that aside and equal that out. The only time to really pick an HMO is if the finances are a huge part of your decision making. It's just like anything else. When you go buy a car, you could buy a Mercedes, you could buy a Chevrolet. I think if a Mercedes and a Chevrolet cost the same thing, I think almost it's fair to say everyone would pick a Mercedes for the most part. So I don't think there's this delusion that somehow HMOs are, better for certain people and PPOs are better for others. I think you just have to make a decision, in terms of economics, because not everyone can afford whatever high price PPOs are out there. But you have to understand, a lot of times, if medical care is important to you, and if something were to happen to you and you want to have more choices, more options, more control, if that's important for you, then PPO might be a better decision, especially if you can make the economics work. So in summarizing some of the sort of pitfalls of an HMO, again, I think we talked about taking control away from you and your doctor. I think what that would look like is, for example, pre-authorization. If you need a certain procedure done, the decision often may not be just between you and the doctor that you need this done, that the insurance company will pre-authorize, meaning their medical directors or their people will sit there and say, well, we don't think this is medically necessary because of whatever. And they will supersede your doctor's decision. So that's number one. Often the doctor who they've contracted with or employ is incentivized, not to do too many tests, too many procedures. So between those two things, between the doctor being reticent often, especially if something's on the fence, as well as even if he or she's willing to authorize it or order it, it still needs to go past another hurdle. So that is much more classic in an HMO than a PPO. Although certain things are still authorized in a PPO also, but not to the extent it is in an HMO. So I think you understand this concept of pre-authorization. The other thing I hit really upon on is your formulary for drugs is going to be severely limited. And if you need some of the newer, potentially higher priced drug, again, you will possibly need pre-authorization much more so than if you were in a PPO setting. The other thing I mentioned too earlier is the gatekeeper phenomenon. So one of the main ways HMOs are able to save costs is they control which specialists you can or cannot see often. And to get to see an endocrinologist or rheumatologist, you can't directly go to them. You would have to go to your primary care doctor. He or she would have to decide that they themselves have exhausted what they can do for that issue and that it warrants a specialist. So those primary care doctors may or may not be the ideal person to take care of that issue, given the complexity and what have you. But certainly in an HMO or PPO, they're going to potentially try to manage it themselves and potentially block you from seeing a specialist. And, while potentially that might be good so you don't unnecessarily see specialists, it can also delay you from seeing a specialist when the condition warrants. So that can work both ways. And just a quick side note, to get raw information like this that you probably can't find anywhere else, please like and subscribe our channel. Leave comments below. We want to help and grow this and bring this to more people. So I really need your help. If you like this, want to see more stuff like this, give us your feedback. The other really important thing about HMOs you have to understand is when you get into the hospital, many HMOs have contracted out with hospitals group, which means they have a set of doctors who are going to be incentivized to take good care of you, but they'll also be incentivized to make sure that your care is very efficient and that your utilization in the hospital is, you can sometimes say appropriate, but otherwise you can say efficient, which means that they're going to be very concerned about your length of stay, how many specialists you see, what kind of procedures you get in the hospital, what has to be done in the hospital, what can wait for you to get out. And, I don't think it's any secret that people who often are in managed care facilities get discharged potentially earlier, maybe appropriate, maybe not, but certainly efficiencies there. Now, some of that is built-in efficiencies because, HMOs have extra resources to get you out quicker and manage you quicker, but that's, not always the case. And so you have to understand that when you get hospitalized and you have an HMO, sometimes that can mean that you get a level of care that's slightly different potentially because they're there not only to take care of you, but to manage their resources effectively. And how that impacts you is, potentially variable. But even in the hospital, potentially, the range of doctors you could see may also be limited by who in that hospital on staff is also under contract by your insurance plan. So even within a hospital, there may be 3 heart doctors that, are all good, but potentially you may only be able to see 1 out of the 3 if that 1 is contracted with your HMO and the other 2 are not. So giving up freedom to see whoever you want is not necessarily only an outpatient thing, but it's also inpatient. So if you land in a hospital and need bypass surgery because you just had a heart attack, theoretically, you may not have access to all the surgeons that are available even within that hospital, right? So you need to understand that you are not necessarily going to be able to pick from the entire staff, even at a hospital. So, and to make it potentially even worse, you may, especially depending on how you get admitted to the hospital, you may not even get to pick the hospital of your choice if you're an HMO plan. So I think, so far it sounds like, everything I've been reviewing is negative about an HMO. It's not necessarily negative. There's plenty of HMOs that give great care, plenty of HMO doctors that are fantastic, but you simply can't bury your head in the sand and say, oh, HMO, PPO, same care, less price, let's go with the lower one. You are giving up something. And maybe I'm willing to tell you straight out, but you're giving up something. The only question is, what is it you're giving up? And just to get even a little more granular about your hospital stay, you have to understand if you're in an HMO and you go to the emergency room, often it may or may not be the emergency room doctor's decision to admit you, but even so, in many HMOs, they're actually going to talk to a contracted HMO doctor who can potentially then decide to admit you or refer you to a contracted facility that the HMO has for a lower level of care, like a nursing home or a rehab. So it won't always be just the emergency room doctor's decision whether to admit you or not. That if you're in an HMO, there will be some utilization done at even potentially at an ER level. So, people think that when they give up some of their autonomy, it's just going to be an outpatient setting where they give up their autonomy with their doctor, where, yes, they and their doctor won't be able to make potentially all the decisions that someone else may have a say in it. But that also applies to pharmacy. That also applies when you go to the ER and whether you get admitted or where you get admitted to. And that also applies to your choice of doctors, not only in an outpatient setting, but even in an inpatient setting. You may have to give up some of that autonomy. The other thing, you have to understand in an HMO, what you also may be giving up is your access to a medical doctor often. More and more managed care facilities are using physician assistant and nurse practitioners to address frontline concerns, especially in an outpatient setting. And actually, surprisingly, also now maybe a little more in the inpatient setting. So you need to understand when you sign up for a PPO, it may be you'll get to see an MD most of the time, or it may be that you will not get to see an MD most of the time. And potentially it may not even be up to you if you do see an MD or a PA and nurse practitioner. Now, taking nothing away from nurse practitioners and PAs, but the issue is not whether you should or should not see a PA or nurse practitioner. The question is, will you have a choice? Okay. And I think, practically speaking, you may not. Maybe some HMOs will tell you you will have a choice, but often in certain situations where the rubber meets the road, those are the only people available or readily available in certain situations. So you have to scout that out, because when you sign up for an HMO, you have to ask, will I actually see a medical doctor? And I think the argument you're going to get from HMOs is for most routine care, colds and sniffles and what have you, a PA and nurse practitioner is as good. And I won't argue with that. But the point is, do you have a choice? Let's say you don't want to see a nurse practitioner or a PA. What are your choices? And even if you do have a choice in certain HMOs, broadly speaking, I think you're giving up some of that ability. Whereas in a private sector, when you sign up with a doctor, you can pretty much say, hey, will I be seeing you? And if he or she says no, then you say, okay, I'm going to go find another doctor where that's the person who I will be interfacing. And lastly, when you sign up for an HMO and the care is delivered by a group of people who vary, are you going to be able to get that longitudinal connection with a primary care doctor? Now, in some HMOs, that's true. You will always see, for the most part, the same clinicians, whether it's a PA, nurse practitioner, or MD, or DO. But I would say, as a generality, there's more changeover and more interchanging of potential providers than there is in a PPO settings, because you can control that. If you sign up for a PPO doctor and he's never or she's never the one to see you, well, you know what? You could just move. But when you're in a PPO, until it's time to switch again, you can't just pick up and go. So I think that ability to sort of vote with your feet, I think, goes away until the next time your renewal comes up. You can't always, vote with your feet in an HMO setting as you can with a PPO setting, where if you're not necessarily getting the care that you want in a PPO setting, often you have the ability, more so than in an HMO setting, to literally vote with your feet. So the next thing I want to talk about is, when you're trying to choose a plan, even for your company or if you're trying to choose for yourself, but even for a company, often you have to understand that, most people do that by going to a broker. And a couple of things about brokers. Generally, brokers are incentivized by the commission they make on the plan they sell you. And often HMO plans are very aggressive in rewarding brokers to bring in plans. And also, since the plans are cheaper, it's an easier sell often for the brokers to sell a company or a business in a HMO plan, because at the end of the day, if you can't sell your product because it's too expensive, you'd rather sell something that's cheaper that you think the person will buy or accept. So you have to be careful that when choosing a plan, there is a natural inclination just to use the cheapest one. If you haven't watched this video, for example, and understand what you're giving up, and you say, well, I'm not really giving up anything, I'm just buying something similar but at a much lower price. So I think brokers themselves may not understand some of the things that people are giving up. And also, it's easier for them to sell a cheaper plan to a new business owner or to someone thinking of switching their company because of the sticker shock potentially of a PPO. But to be totally fair, I think a lot of companies also realize that they don't want to provide a hardship for their employees in terms of signing up for a PPO. But I think a good situation would be if an employer offered a basket of things, some PPO, some HMO. But if your employer is just basically offering an HMO, I know sometimes that comes from a good place because they're thinking, oh, I don't want to place a burden on my employees, especially if the employees have to pay their share of the insurance payments. So they think they're helping their employees. But, it's only a help if you never need the plan. But if you do need the plan, you may realize that wasn't the plan for you. So before I end, I also want to talk about a PPO. Obviously, reading between the lines, I think you understand, depending on the PPO, depending on the deductible, not all PPOs are, the same, and not all HMOs are the same. But all things being equal, I think reading between the lines, I think you probably figure my position is that if you can afford it, and you could afford the deductible and you can afford the payments, all things being equal, you're probably going to have more flexibility with a PPO. Having said that, there are some downsides, and I've alluded to it slightly in this video and in other videos. If you get a PPO, yes, you may not have a gatekeeper, and you could wind up walking into, a GI, doctor's office, cardiologist, rheumatologist, endocrinologist. I mean, you could walk in potentially and make an appointment with all those people theoretically. And the question is that the best thing for you all the time? A lot of times, yes, but sometimes no. Sometimes you probably want a primary care doctor to handle that, because if you go, I hate to use this analogy, but if you go to Midas, what do you think they're going to tell you need? They're going to tell you need a new muffler. I mean, it's not it's not like that in medicine, but on some level it is too. If you shop a lot of specialists unnecessarily, you may get care or procedures that weren't necessarily right at that time. So you have to understand, if you're going to get a PPO, you still need to have a great relationship with a primary care doctor who can advise you when it's time to, seek out a specialist. If you use a PPO as a carte blanche just to randomly, go to different specialists, then that potentially then could be a downside of a PPO. Then you might be better off in an HMO if you can't find a relationship with a primary care doctor that has the whole picture, that knows you and gets to know you. This idea of unnecessary visits, unnecessary tests is also not good. So it's not all rosy for the PPO side. There's the finances, the deductibles, and this sort of open access to a lot of different types of medical care, which you may or may not need. Thanks for watching. If you want me to clarify anything on HMO, PPO, or any other similar topics, feel free to leave a comment below. And if you like content like this, please like and subscribe and support our channel. And as always, be well and take care. Thanks for watching. Bye-bye.